Our organization is the UCSF Benioff Children's Hospital, Oakland. This hospital was actually founded in 1912. And it was called the Baby Hospital back in the day. It's been serving the children of the Bay Area and Northern California for over 100 years now. So there's definitely a legacy with our institution here. It was formerly known more recently as Children's Hospital Oakland, and then we established a formal affiliation with UCSF in 2014. So now we're part of the UCSF Benioff Children's Hospitals. Our hospital is really special because we're a level 1 pediatric trauma center. We also have a very busy, bustling emergency room. And we also have pediatric and neonatal intensive care units and inpatient services with over 30, even probably more than that, different subspecialties that work at our institution. And we have a very large pediatric outpatient center, which is both for subspecialty care as well as general pediatrics. And on top of that, we are a teaching hospital with over 75 pediatric residents and several fellowship training programs. So we have impact in training the future generation of medical providers. I have been graced and benefited to be able to be here for over 20 years. I came here in 2001 as part of the Infectious Diseases Division, and I'm the co-director of our Oakland subdivision here. And personally, I've been working here to provide care, including pediatric tuberculosis care for our community and surrounding counties in these last couple decades. And that includes diagnosis and management of children with latent tuberculosis infection, children who are actually diagnosed with active TB, and certainly kids who are exposed to others with active tuberculosis. We really have a special population of patients here. We're very honored to participate in their care. Our pediatric primary care clinic is actually a federally qualified healthcare center, or FQHC, and that serves the local population here, which is actually very culturally diverse. And our neighborhoods include folks of many different cultures and ethnicities, as well as new immigrants and refugees. And there's a very large Asian and Pacific Islander community here that we serve, which of course is a group that's at high risk for tuberculosis. But we also have, as part of our FQHC, what we call a Center for Excellence for Immigrant Child Health and Well-Being. And so we have a specialized international clinic within the FQHC that serves patients who are new immigrants or refugees, so we can address their special medical issues that they may have more risk for because of their recent immigration status. Our mini grant is a project to develop tools in our electronic health record to improve tuberculosis screening, testing, diagnosis, and management. Since college, I actually have had a strong interest in working with computers. I was an electrical engineer in college, and so I've always enjoyed kind of playing with computers and systems. And I was very involved in our electronic health record when we first went to the electronic health record format in 2013. And then in 2019, I became the medical director of informatics for UCSF Benioff Children's Hospital, Oakland. When I became medical director in 2019, I realized that it opened a lot of doors for potentially developing tools and things to support medical decision-making in the computer system. And so when we got this opportunity to do this mini grant with you guys, it was the spark that kind of generated the momentum to actually build change in our electronic health record. Providers are always complaining how the electronic health record can be really hard for us or cumbersome, but our goal is to make things better, improve patient care and improve support for the providers. And so when we looked back at how we've been doing in terms of TB care and education for our patients and community, we realized that although our providers had been doing a pretty good job of screening for TB risk factors, the follow through that came after that, there was actually a gap in terms of our patients being subsequently tested and then going through treatment. So this project was to create these tools for improving our screening and for improving testing and diagnosis, and to build basically a home in the electronic health record for tuberculosis information to be centralized. And that way, it's easier for providers to actually find this information, realize that our patients have been tested, realize that they've been treated, and that they don't have to go through these things again. And to have our electronic health record remind us that we should be doing TB screening for pediatrics on an annual basis. And so we built, wanted to build things in the record to kind of support the providers for that. And because everything is so electronic, we wanted to be able to generate reports that would then tell us how we're doing in terms of how well are we screening, how well are we following through with testing and treatment. So it was a really exciting opportunity to build something real in the electronic health record to make things better. The outcomes that we're hoping is to have are to improve how well we are taking care of our kids in our community, to improve screening, and to make sure that it's built into the system to remind us to actually do tuberculosis risk screening every year. And again, we're pretty good at our FQHC already in terms of that. But to make that as built in as part of the record to trigger a reminder for us, especially if we have new providers that come to our institution. And so the creation of a care gap that helps to monitor this and to remind us, and then to actually build a place in the electronic health record to actually do the screening, and then have a place for us to document the risk assessment questions, the answers for those, and then to see how well we're doing in terms of making sure we see enough patients and do these screenings to make sure that we're not missing kids as they're coming to our clinic. So our goals are to improve that care gap that we're seeing in the care cascade, where we do a great job of screening, but are just missing the testing and the follow through on that. And our hopes is that we'll be able to look at the reports that are generated from this project and encourage providers to do an even better job in providing TB care. And to centralize all that information, I think is going to be a game changer for us, because now that we have a place in the electronic health record to collect all this information, other subspecialties and other clinics and other providers will be able to look and say, okay, here's the information for their TB screening. And if they end up going on immunosuppressive medications or need some kind of treatment in the future that could put them at risk for activating TB, that there's a place for all this information to be captured so that we can better take care of our patients in the future. So I hope that the outcomes from this project are that we are going to improve TB care across the board. We're starting with pediatrics, and that's what this mini grant was focused on. But our goal eventually is to potentially move into the adult world too, to see if we can build in TB screening for our adult clinics, as well as our adult subspecialty clinics where these immunosuppressive medications and treatments may be used. So we want to make this a very accessible part of the electronic health record so that we can improve TB care across the board. I think we've been very fortunate over the years to have such a good relationship with our FQHC primary care providers. Our physicians here have actually worked with them over the years to promote education about TB screening and TB LTBI treatment in particular. I think back in the mid 2010, 15, that time period when rifampin, the 4-month course of rifampin was promoted as the better treatment course for latent tuberculosis infection. We worked really hard with our partners over the FQHC to kind of promote that information in terms of better treatment, shorter courses with better adherence and better completion. And our partners are so wonderful in that they're so dedicated to this population that we have, this patient population we have, that it's been so wonderful to work with them. And their enthusiasm over the years is so inspiring because they're so dedicated to the kids that we see. It's also been a super privilege for me and our groups to work with our public health groups. Alameda County TB Control has been wonderful over the years, the 2 decades I've been working with them to take care of pediatric patients. And the California Department of Public Health, the TB division, has been wonderful too. They've been very active and enthusiastic about this project, and super excited at the build that we've made. And they're very much looking forward to how this build performs in terms of improving TB screening and TB treatment. So I feel very, very fortunate for that. We fortunately had relationships with the Alameda County TB control from the beginning, because we used to actually go out to the county clinics to actually take care of patients exposed to TB and patients with TB, LTBI. And so our relationship goes back decades. And so I feel like there's a sense of trust and familiarity between our groups, which has been really wonderful. And they're certainly wonderful, wonderful groups to work with. And of course, our FQHC are often have been the residents that have graduated through our residency training program and have become attending physicians there, that I've known since I was a baby intern here. That it's just been a really wonderful relationship with them. So I just feel very privileged to have the opportunity to work with such great people. There's still opportunities for improvement. I mean, if anything about this COVID pandemic has taught me is that when things like this happen, important infections and disease processes like TB sometimes get shoved aside. They get neglected because of other priorities that happen. And we have to continue to bring the spotlight back on tuberculosis because it's such an important ongoing issue that's simmering under the surface. And this project is just really giving us an opportunity to really bring this to light. We just met with our FQHC providers earlier this week to share with them some of these tools that we've developed and kind of reinvigorate them. And it was just really inspiring to see how much energy they had about, yeah, let's do this. Let's really improve our TB screening and our testing and our treatment. And so I'm so very much looking forward to seeing how these tools that we've built will impact our patient care and outcomes. And then I've been really excited as we've presented these tools to the greater UCSF community, that I've actually gotten unsolicited emails and messages and inquiries from the adult group saying, hey, can we get this information? Can we have this TB screening? Can we build questionnaires for our patients too? And then the West Bay, the Mission Bay campus and their pediatric clinics there, were not part of our original pilot, but they're very excited about, hey, can we bring these tools? Can we make these tools live for us so the kids in San Francisco can have this too? So I feel like these tools are going to impact more than just even the local Oakland area. And I think we're able to reach all across UCSF. And if these tools are as successful as I hope they're going to be, we can present this information back to the parent electronic health record company and potentially have these tools be developed and used at other institutions across the United States, because there really isn't something standardized that's built across this EHR in other places in the United States. I've looked for what's available out there, and there really hasn't been anything that's really gained any traction. So our hope is that this is something, kind of a starting point for other institutions to build EHR tools for them, so that we can have them learn from our experience and potentially disseminate this sort of home for TB in our electronic health records across many, many other places. So I'm very excited in seeing where this is going to go. It's just so exciting to be able to do something like this, to conceive of an idea and then actually bring it into being, and then hopefully watch over the next year on how it changes and how it makes things better for our kids.